Each year in the U.S., there continue to be new HIV infections. The CDC estimated that in 2006, over 56,000 people were newly infected with HIV. Many people are dangerously uninformed about the virus. Experts say education can help to overcome such a lack of knowledge and thereby prevent HIV infections from occurring.
Everybody needs to be educated and understand the importance of HIV testing, from the general public to the healthcare providers that are providing their medical care. There are many types of education available, and the education should be directed specifically at the group. For instance, a dentist would benefit most from listening to another dentist talking about the oral manifestations or what might be seen in the mouth of someone who is living HIV positive.
The face of HIV is changing, and early detection is key to our future health and well-being. The CDC recommends routine HIV screening for anyone ages 13 to 64 seeking health care for any reason, without regard to known risks for HIV infection, and recommends annual HIV screening for those known to be at high risk.
Everyone who has sexual contact is at risk. We're trying to take the stigma out of HIV testing such that it would be as acceptable as a routine blood test or something such as a mammogram. We know a mammogram is an excellent screening tool, and if we detect breast cancer early, the outcome is generally much better. We want the same applied to HIV testing.
One of the best lines of defense against HIV starts with the community of medical providers. It is critical that they not only understand the signs and symptoms, but know who and when to consult and know when to refer.
We offer 5 levels of education, ranging from the traditional classroom lecture style to technical assistance, for which we would go on-site and help providers with things such as quality assurance program and policy development. Our traditional classroom lecture topics include things such as how the medications work and when they should be started. Additionally, we offer preceptorships at which people can come to our clinic and gain first-hand experience with the management of an HIV-positive patient. So ideally, the sequence would be to have a provider in the classroom with us, let them build knowledge and skills, and transition them into a preceptorship where they would gain that first-hand experience under our supervision.
The Infectious Diseases Institute at the University of Oklahoma Health Sciences Center is a co-director and local performance site of the Texas-Oklahoma AIDS Education and Training Center, or AETC. The center is a professional resource for medical provider education, consultation, and technical assistance.
The AETC is the educational arm for healthcare providers. The mission of the IDI, or the Infectious Diseases Institute, is to care for people with HIV and AIDS in the best way that we can. This includes their medical issues, psychosocial issues, case management issues. We really try to do everything we can for the patient to put them in a positive environment and get them going as well as they can.
To address the critical shortage of HIV specialists, the AETC program focuses on training for healthcare providers within 6 major target groups: physicians, physician assistants, nurse practitioners, nurses, pharmacists, and dental professionals. These trainings include conferences, workshops, clinical preceptorships, clinical consultations, and technical assistance.
Well, this program is unique in that it's very tailored to our providers' level of experience as well as their cultural settings. We don't come in and just provide a didactic workshop. We actually are able to provide ongoing trainings at different levels depending on a physician's experience or a nurse's experience. The other really great thing about this is there is no charge for this program whatsoever. And so physicians or other medical providers are able to get continuing medical education credits at no cost. We do all of the traveling, so we come to you. That means less downtime for the clinics and the clinic staff.
AETCs collaborate with Ryan White CARE Act funded organizations, area health education centers, community-based HIV/AIDS organizations, and medical and health professional organizations. Clinicians trained by AETCs have been shown to be more competent with regard to HIV issues and more willing to treat persons living with HIV than any other primary care providers.
Well, we are really fortunate. We have federal funding that allows us to give medical care to this community of individuals. And so if we have a newly diagnosed individual that's been identified, we immediately link them with a patient advocate, a medical case manager, and an infectious diseases specialist. And often these folks have some psychosocial issues associated with that diagnosis. For instance, they may have depression or other mental health issues. And so we can link them with a provider in the clinic that can specially handle those situations.
The Infectious Diseases Institute is located within the heart of the University of Oklahoma Health Sciences Center campus. It is comprised of nationally known faculty consisting of infectious diseases specialists committed to providing the highest quality patient care, education, and research possible.
We have an absolutely fabulous faculty and staff. The physician providers are all board certified in both internal medicine and infectious diseases. And some of us have been taking care of folks with HIV for more than 20 years. The staff are top-notch. We have to have a fairly large staff to run a clinic such as we do. This includes folks in phlebotomy, folks in case management, folks in counseling, and they are absolutely top-notch. We have a wonderful one-stop shop, so to speak, for folks who come up. We have a laboratory right on site. Right next door to our patient care area, we have the case management and counseling centers. And it's really important because we can have folks come up and get their laboratory, we can see the results, we can examine them, take care of them, take care of their psychosocial needs. And that really helps us prescribe the right medications for them, to know when we're dealing with side effects, and to know how to care for the patient as an individual. These things are all critical for providing the best outcome possible, and we see some tremendous outcomes. It's a whole different ballgame than it was 20 years ago.
Because the University of Oklahoma Health Sciences Center is a medical teaching facility and each of its specialists holds a faculty position within the College of Medicine, its patients are assured of receiving the most up-to-date and comprehensive care. Ongoing research in the field of HIV/AIDS is a critical piece of the care puzzle. The Institute provides access to a number of clinical trials related to this disease. For more information about provider education or to donate to the care of HIV/AIDS individuals in the program, contact the Infectious Diseases Institute at the University of Oklahoma Health Sciences Center or visit oumedicine.com/infectiousdiseases.